Hello. Today the drug I want to discuss with you is vancomycin, or as most people call it, Vanc for short. It's one of the most widely used antibiotics in the U.S. hospitals, and it's used primarily to treat severe infections. It can treat C. diff, MRSA, and other serious infections. It's active against gram-positive bacteria, including both of the species that are methicillin resistant, so that is one benefit to having vancomycin. It's also used as an alternative to penicillins in patients who have allergies to penicillins. In the OB world, we use Vanc to treat group B strep in people that have penicillin allergies. Vancomycin is available either IV, by mouth, or rectally, depending on the need. Mostly it's given by IV infusion and usually infused at a slow rate. Oral administration is generally only for infections of the intestines such as CDI. This is also why it's used rectally. Vanc sufficiently treats most cases and distributes to many of the body fluids and the tissues. It does get into the CSF, but sometimes it's still not enough to be effective, so an intrathecal dose may be required. Vanc is eliminated by the kidneys, so it's important to keep a check on those, and your doses may need adjusted for those people that are in renal failure. Renal panel can be drawn by the lab to keep an eye on the kidneys if suspicion of toxicity occurs. There are several common side effects to Vanc. The first one is renal failure. Serum Vanc levels should not be greater than needed to prevent the renal toxicity. So therefore you need to monitor your Vanc level, monitor your kidney function as well. Ototoxicity is a side effect of Vanc, but it's actually fairly rare, and it can usually be reversed, so that's a good thing. Thrombophlebitis is a more common side effect of Vanc that can be prevented by frequently changing your sites that Vanc's being infused through. Thrombocytopenia is another rare side effect in which platelets are lost and spontaneous bleeding occurs. One other side effect is Redmond syndrome. Redmond syndrome is a constellation of disturbing effects: flushing, rash, urticaria, tachycardia, hypotension. These are all negative things, but a common side effect. A lot of times these effects can be minimized or eliminated by infusing Vanc slowly, over 60 minutes or more. Currently in our unit, we had many cystic fibrosis kids who oftentimes are treated with vancomycin because they need this strong antibiotic to treat the lung infections they have. And several of the ones that regularly get Vanc have developed Redmond syndrome. And even though it's listed as an allergy, the pulmonologists want to treat through it. So we pre-treat with Benadryl and run it slowly. Sometimes that 1 hour becomes 2 hours if that safely gets the medication in the patient without the side effects. Vancomycin is also fairly cost effective and affordable, especially many available coupons. When I did a little research online to see how affordable it'd be for somebody without insurance, there are coupons available that can make this drug cost between like $20 and $30. And then, of course, we all know on your hospital bill, medicines are more expensive. Vanc does interact with some drugs. One drug it interacts with is Amican. Using Amican together with Vanc may be extremely harmful to your kidneys and cause nerve damage. This nerve damage can lead to hearing loss, so it's important to tell your doctor if you experience dizziness, numbness, skin tingling, muscle twitching, or seizures, or any sign of any kind of nerve damage. Also, Vanc can interact with tobramycin, gentamicin, and Coumadin. With these drugs, it can increase the side effects of Vanc. So, what may or may not have caused Redmond's might now. If you use both of them, ototoxicity becomes more common, things such as that. So, Vanc is used often. It's important we all know about it, know about the side effects, what to teach our patients, what to teach new employees, etc. So if you have any questions, just let me know.